Hi everybody, welcome back to my channel. This is Allie from Allie Answers. So maybe you slip and use the wrong terminology sometimes when you're talking about your loved one and the care that they're receiving. No big deal, right? Yes, it is a huge deal. So let's talk about why it's important that you understand the care that your loved one is receiving and that you use the right words when communicating it. I'm not here to shame anybody. As a matter of fact, I have many videos on my channel that will explain the differences, for example, between home health and hospice, or home care and home health, and also some videos that will explain the differences in senior living. So let's get into it and talk about why it's important that you're using the right terminology. So in my company, I actually have access to hospital records when I am trying to help someone get admitted to service. And I'm able to go in and see what was written or what was said by the physicians and by the family and what recent history has been like for those patients. That's important for the nurse and the physician to help figure out if hospice is appropriate for that patient. Today, I was reading someone's history, and I happen to know from personal experience that the history that was given by the family member was completely wrong. This patient was at an assisted living, which has a very different standard of care and different scope of care than a nursing home. Often, adult children call anything that their parents live in a nursing home. So whether they're living in a personal care home, independent living, assisted living, personal care, or memory care, we often find that adult children refer to everything as a nursing home. Now that is a problem because this doctor who took this information and was reading through it and making a decision on care for this lady thought that the woman was coming from a nursing home. She wasn't. She had recently been in an assisted living that by choice of that company has limited scope on what kind of care they offer. Doesn't mean that they don't offer excellent care, but it is a very different type of scope than long-term care situations, often referred to as a SNF or a skilled nursing facility. So you can see when people are trying to plan appropriate care for a patient, if they think that the person is going back to a place that is going to give a certain level of assistance and they're not going to get that level of assistance, it could be a problem. This is just one example of why calling everything a nursing home is not a great idea. I know it can be a hard habit to break, but it is very important that you do. Your medical providers are not able to give the right kind of care if they don't have a good history. So let's talk about another example. If you take your loved one in to see the physician, especially if it's a specialist who is not as familiar with the intricacies of care that your loved one is receiving, if you tell the medical provider that your loved one is receiving home health, when in fact they are receiving home care, then that is again a different scope of care, as we've discussed in other videos, and feel free to look back through other videos and watch them. They're usually very short but informative. Home care is private pay. It is basically companion sitting. It is often assistance with bathing, dressing, and grooming, but it is not physical therapy. It is not occupational therapy. It is not speech therapy, and it generally does not include nursing. So giving the wrong information to the provider could actually keep a loved one from getting the right care that they really deserve. You can see that giving the wrong information or using the wrong word could prevent your loved one from getting the care that they need. If you tell the physician that your loved one is already on home health, but they are not, that doctor's not going to write an order for home health, which might get you more care. Also, home health is covered by insurance, where normally speaking, home care is not. So again, no shame at all, but it is very important that you understand the terminology that you're using. If your loved one is living in a personal care home or assisted living, please make sure you use that language when speaking to a physician. If your loved one is in memory care, that is something that your doctor is going to want to know, especially if it's a neurologist or someone of that nature, because their job is to also make sure that the person is receiving the right amount of supportive care and that they're in a protected environment. What I want is for you to get the very best care for your loved one that you possibly can. And by using the right terminology, that will help you. Thank you for watching. I'd love to hear what you think of this video and what kind of other terminology have you had trouble with in the past. If you'll hit like and subscribe, more people will see my videos and we can do more good. Have a great day. Bye-bye.